Hello everyone, here we have our EMS patient that was called in by a family member that said he was not acting correctly. 60-year-old male, no trauma that we know of, no diabetes that we know of, no other trauma that, or any other reason that we would know, no seizure history. So, we're going to start with our EMSA, EMSA stroke assessment card. So right from the very beginning, so are you able to follow with my pen, or you can use your finger, totally up to you. I'm going to start here, and I'm going to go to the left, come back to the middle, and come to the right. He is unable to track that pen very well, so he scores a 1. Facial droop, we're going to start right from the card. Ask the patient to show their teeth or smile. Sir, are you able to smile for me or show me your teeth? He has some definite droop on the right side that's very distinct. He gets another point. Arm weakness, sir, I'm going to ask you, can you hold up both your arms and put your palms up in front of you? Okay, his left arm is moving very clearly. His right has no movement at all. Okay, so he gets another point. So you can go ahead and put your arm back down for me. We're going to move to legs. Legs, sir, I'm going to ask you to lift up one leg at a time. Are you able to move your left leg? Okay, excellent. Go ahead and put that down. How about your right leg, the one I'm touching? Okay, he's unable to follow that command. He gets another point. So he has facial, arm, and leg weakness all are points towards him. Now we're at the slurred speech. Naming, ask the patient, sir, are you able to tell me what this is? I'm not able to understand what he's saying, so he's going to get a point. This last one, I have trouble remembering it, so it's okay to read it directly off the card. Sir, I'm going to ask you, can you repeat this rhyme or this sentence for me? They heard him speak on the radio last night. He's not able to say that very clearly at all. He would get another point. So this patient on the emergency medical stroke assessment card scores a 6, and that's all categories. So before you call the TCC, make sure you have your vital signs, make sure a pre-hospital blood sugar hasn't been checked, that has been done, and that you have your score ready to go when you call. And the TCC is always going to want to know, and everybody wants to know, when was the last well-known time. So when was he last seen not like this, or normal for his day-to-day. Any suspected stroke patient should be entered into the trauma communication system or the stroke system as early as possible. In addition, giving an EMSA scoring, an IV placement, a bolus of 500 cc's of normal saline. If time allows, a 12-lead EKG to look for any new onset dysrhythmias. In Alabama EMS Region 1, any patient with an EMSA score of 4 or greater is likely having a large vessel occlusion and will be directed to Huntsville, Maine by the TCC when interventional radiologist services are available. A patient with an EMSA score of 3 or less likely does not have a large vessel occlusion and will not likely be specifically directed to a level 2A stroke center. So we're going to do a dry run, just talking through of what we would do to call the Alabama Trauma Communications Center. Hi, my name is Rick. I'm on Medic 12, HEMSI. I have a stroke patient to enter to Huntsville Hospital, Maine. Ensure that you have a last known well time, blood glucose, an EMSA score. They may ask questions of what category that came out of and be ready to use your card to give that information. As a side note, we love to have a family member or a family historian that would be able to accompany the patient, or at a minimum a phone number for the hospital to contact this patient. Using your EMSA or EMSA reference card will increase your accuracy, whether it's the card or whether it's a reference mounted to your ambulance. Either one is acceptable, but it will help you do a better job for the patient. As always, thank you for watching our video. If you have questions or comments, please contact your training and or supervisor, and have a good day.